Hi there. Welcome everyone to our webinar, Succeed Through the Surge, 4 Steps to Keeping Your Practice Running During a Difficult Winter. And my name is Jacqueline Hurley, and I am going to wait just a couple more minutes while people are still jumping on to see if we can get a few more here. I keep seeing our numbers are growing, so let's give it just a couple of minutes. Well, it looks like we have a few more just last minute jumping in. I mentioned earlier, I'm Jacqueline Hurley. I am the Business Development Manager here at Solution Reach, and I've been with Solution Reach for the past 11 years, and I'm excited to be the host of this webinar today. I'm gonna go ahead and get started. The one thing you want to know is how to ask a question. These questions are for our presenter. If you have a question that we could answer, she could answer for you, that would be great. Or if you have a question, if you're having technical difficulties, I can respond kind of on the back end to any technical questions. Also, if you find yourself frantically taking notes today, just so you know, you will receive the slides from this presentation as well as the recording. We are very active on social media. Right now is a great time to connect with us on Facebook, on Twitter, and LinkedIn. We are wherever you are at any of those platforms. And if you happen to be a Solution Reach client and have any support questions, you can visit community.solutionreach.com, click on My Support, or you can email community@solutionreach.com, and our client success team will be happy to assist you. I would like to introduce to you, we're just going to get started, our presenter today, Lori Boyer, who is in her new role as manager over brand and campaigns here at Solution Reach. She has spent more than 10 years researching and developing best practices for healthcare organization. She's written and published hundreds of white papers, guides, checklists, ebooks, and more on practice management. She is kind of my go-to person whenever I have a question of things that are going on out in the world and practices just like yours. She manages a healthcare blog with over 24,000 subscribers, and we'd love for you to join her blog. That you can go there by going to www.solutionreach.com/blog. She also hosts an educational video series teaching practices how to best manage their office. So we're super excited to welcome Lori today. And Lori, we're going to just switch this over to you and see if we can get you started.
Awesome. I'm very excited to be here. Let me just get the screen. Okay. There. Can you see my screen now, Jacqueline?
It's loading. There we go. Yep, got it.
Perfect. Okay. Thank you so much, everyone. Thank you, Jacqueline, for that great introduction. I am really, really excited to be here. It's mid-afternoon here in Utah. I think it's late afternoon, early evening. Hopefully some of you have finished your day already on the East Coast, and we're really just thrilled that you would join us. I hope that you guys have had a good day so far. I'm really, really excited about this topic today. So it's about succeeding through this surge. So I think somebody said to me the other day, Lori, you're probably more tired of talking about COVID than anyone I know, because my whole life has been educating about COVID this last year. But I know that you guys have to be even more than me. So just know this is kind of, I feel like, our last big push is to survive and succeed through this winter. Before we start to get those vaccines really out to our general public. And so at that point, I think that it's going to be a little bit easier for us. But until then, there are some things that we need to do to kind of keep ourselves running. And that's what we're going to talk about today. So the agenda today, there are 4 main points that we're going to talk about, include being ready for exposure. It's inevitable at some point here, if you haven't already, that you're going to have some illness and some exposure in your team. And so we're going to talk about what you're supposed to do when that happens and how to plan for it. In addition, we're going to talk about mitigating your team member stress. This is a big issue right now, so that's something that I really want to make sure we talk about. We're going to talk about using technology to kind of streamline some of your processes, and I like to call it turning it into another team member. Technology can really be a big boost to you. And then developing a strategy to keep your practice running no matter what's going on. So if you happen to be in an area that's really heavily hit or is experiencing more extreme kind of lockdowns or some of those kind of things, that you have a strategy that you can keep going. So with that, we are just going to dive right in. So the first thing we're going to talk about is being ready for exposure in your practice. Things are getting better. I know that it's been a little bit of a rough year, and we have a vaccine now, and there are still, however, a lot of cases out there. In fact, right now with this surge, the United States is seeing by far the most cases that we've seen throughout the pandemic. And this is going to continue. It's winter. It's the time when we go inside and we share love and meals and germs sometimes. So especially I think with the holidays, this is something really to be aware of, as we've got Christmas next week. I know a lot of people have modified those, but even still, we're probably going to see some additional boosts in cases after Christmas. So my thought from all the reading I do, so let me tell you, my life is spent pretty much researching and understanding the latest trends for you, for the industry, to try to understand how it's going to impact you. That's pretty much like where I spend most of my time. So I have spent a lot of time reading and researching up about COVID. This is what I'm hearing from experts, is that somewhere between April and June, depending on your state, the general masses should start being able to be vaccinated. That means that as we go through, especially January and February, while it's awesome, we're going to get some vaccinations out there. Unfortunately, we'll probably still be seeing kind of high numbers until then. So that's kind of just for your own planning. Just know that that's probably where we're going to be. So this is what some of our rules are. Let's talk about what you need to do if a patient tests positive. So let's say that you had, Sarah Strong, and she came and visited the practice on Tuesday, had her eye exam, chatted with you, ordered some glasses, did whatever. Maybe if you're a dermatology, maybe she came in and had an assessment or whatever it is. You've had a patient in your practice and they are now call you and say, hey, on Wednesday I tested positive for COVID. So what do you do now? First thing you need to do is identify each staff member at the practice who was in contact with that patient. And then you need to assess what level of risk was. High risk, as determined by the CDC, includes anyone in your practice who was within contact, who had contact with the patient within 6 feet for 15 cumulative minutes or more. So 15 cumulative minutes is a really interesting number. It's so just so you know, and for practical purposes, it's within a 24-hour period. If you were with the patient for 5 minutes and then 5 minutes later and then 5 minutes later, that's now 15 cumulative minutes. You don't have to be with them for 15 minutes in a row to be considered a high exposure. You could have been with them for 1 minute 15 times or any of the variations in there. But if you were in contact with them for 15 minutes or more within a 24-hour period and you were not wearing PPE, specifically masks are the most important here, then you are now considered high risk. So any of your employees would now be high risk. You're low risk if either it was less than 15 minutes, it was farther than 6 feet apart, or you were close and it was 15 minutes, but you were wearing your PPE. So if, however, you had a high risk exposure, what the recommendation are is the CDC has like kind of just shifted this just in the last week or two. If you have a high risk person, they need to quarantine for 10 days from the day that they were exposed. So if they were exposed on that Tuesday, 10 days does include weekends and everything. You go 10 days from that Tuesday. Now, you can also do 7 days if you get a negative test at day 7. So what you can't do is go get a test like on day 1 and then come in at day 7, because typically the tests don't show up as a true positive until you're at least days 3 to 5. So usually after exposure, about days 3 to 5 is where the test will actually show up. Before that, you'll get false negatives. So you need to wait till it's about day 7. Go in, hopefully you can get a rapid test. If not, maybe go in on day 6 and see if you can get a result by day 7. And you can stop quarantining at that point. Low risk people do not need to quarantine. I go ahead and clean and disinfect your practice as you would expect. So if a staff member tests positive, this is fairly similar. Obviously, your positive staff member has to quarantine if they have COVID. And for the person who has COVID, the rules are 10 days after their first symptom appeared, or 10 days from their positive test if they did not have any symptoms. So let's say that you went in, you had a high risk person, they went in and tested on day 7, tested positive, and they didn't have any symptoms. Their 10 days start from that day that they got the test. If you have symptoms, it's 10 days from your first symptom. You do have to have symptoms gone. So, you can't, day 11, you got 102-degree fever. Yeah, that's still needing to quarantine. But generally, assuming your fever's gone, your symptoms are mostly gone, day 10, you can come back. So if that staff member, so let's say your front desk person calls in and says, hey, I have tested positive for COVID. This is what you need to do. First, you need to notify all other staff members and get detailed information on when they were last in contact with this person. Try to find out what they were doing, how long it lasted, all the kind of things you need to know in order to determine how high risk or low risk they were. Again, high risk is going to be the same. It's the 6 feet, 15 minutes without PPE. That now becomes high risk. Here's where I'm hearing it the most from practices. I've talked to a lot of people, and typically everybody's pretty good about wearing their PPE. However, some people are getting hit by having lunch together. So obviously when you have lunch, you have to remove your mask. You're going to be sitting together, chatting. And so I've talked to offices whose entire offices met together. They closed the office. They'd always met and had lunch together, and everybody had to quarantine. So even though it's really lame right now, we want to be talking and we want to be spending time together. Be careful about those kind of things. In addition, if you're, holiday parties, I do hear about people still having holiday parties, getting together, thinking I'm with my staff all the time. The problem is if you were you were exposed to the entire staff, right? So just be careful if you're doing any sort of contact together without PPE. If the contact was low risk, however, so let's say somebody was wearing their PPE, the rest of the staff can continue working. But the CDC does ask that you monitor yourself for symptoms and you be super vigilant that you continue to wear PPE at all times, especially around patients, obviously, so that you can make sure that you're keeping everybody safe. Another great thing that is recommended is to have your staff all seek testing in that 3 to 5 day range after they were exposed. This will, again, just give them the chance to make sure that they know whether or not they had it. If we have those kind of asymptomatic people, that may show up. And of course, this is going to depend on your state. So some states are not as available to letting anybody test, but most places you can get testing in that 3 to 5 day range after. So I do have people ask me a lot, what about patients? So the front desk person was sick, turned out positive, do we have to contact all the patients? The short answer is yes, but also no. So typically they're going to be contacted by the contact tracers in your state. The health department should contact you. And so so let's say the front desk person tested positive, then what's supposed to happen is that they don't even have to call you. The health department would call you. Obviously, you'd probably hear from them first, and say, hey, you've all been exposed, and could you please give me the list of anybody else who's exposed, and I'm going to contact them, and so on. What I have been hearing, however, is that in states or in areas even, that are seeing really high numbers, or maybe just doesn't have the staff available, contact tracers have not been able to reach out to everybody. So I know we had a time period here in Utah, for instance, where the contact tracers had to simply ask the person, say, hey, you're positive, could you please notify everybody who's been around you? Or something like that, in a method of having a little bit more hands-on. They simply don't have the bandwidth to be contacting so many people when the numbers are really, really high. So there is a chance that you might have to contact those patients yourself. However, hopefully that won't happen. Okay, so let's talk about if the provider tests positive. Again, this is a staff member, so it's the same. The only difference is going to be that you may have to reschedule appointments. Again, this is going to depend on, you're going to have to reschedule, whether you have to actually shut, like I do know some single provider offices, the provider tested positive and they just had to shut down. They didn't really have, another doctor who was rotating through or whatever. Hopefully that's not you, and you have something set up so that if your doctor does need to be out, that you have somebody who can keep things going. But make sure you develop a plan for rescheduling. So I would actually create wording right now of what you're going to say if you are notifying the patients. You may want to say something like, Dr. Jones has an unexpected personal emergency and will not be able to see you. Please reschedule here, send a link, or call the office, or whatever you want to say. I do have some people saying, should I say they have COVID? Should I say they don't? I don't see any reason you need to. On the flip side, I don't really think you need to lie either. There's nothing embarrassing or wrong about it, but I would probably stick more generic. Just, we've got this own personal situation or emergency or whatever, and so they'll be out of the office. Finally, with providers testing positive, don't try to call every patient. Just make sure you're using like text message. Usually you can create a group message to all the patients who are going to be seen in the next however long the provider's going to need to be out, and you can send just one message that'll go out to everybody. So that's the best use of that. I have been really curious, though, about how many of you have actually already experienced exposure in your practice, whether that's, I don't know, a staff member, a provider, a patient. So I would love to hear about that. So we're going to have a quick poll, just get everybody wake up a little bit here on this Wednesday afternoon. Jacqueline, do you want to share that poll with us? Perfect. All right, I'm going to give you a couple more minutes. Most people have voted. I'm going to wait 5 more seconds. We're at almost 75%. Okay, perfect. Yep, let's close that poll. Great. So here are our results. 57% of you have already had an exposure in your practice. 43% have not. This is fairly similar. The numbers were flipped. We had a morning session, and I think it was 58% had not, and 42% had. But we're kind of in that range where it's sort of almost 50-50. Probably if you're on the no side somewhere here throughout the winter, you will have an exposure. So make sure you have that plan ready. If you've already had it, think about what went well and what didn't go well, and kind of edit it and evolve your plan as needed. So that's super interesting for me. Thank you for sharing. Okay, the next thing I want to talk about. So if you're all ready for potential exposure, the next thing that I've been hearing a lot about is team member stress. So it's interesting, as I was creating some of the content and the different pieces that go along with this webinar, I had come across an article that talked about stress levels. And, you know, it's a hard time of year anyway. Often for a lot of people, it can become very stressful. COVID doesn't make that any better. It makes it a lot worse, I think we all know. But I was also talking to an office manager the other day, and she just shared that she felt like everybody was a little bit stressed, not just her staff members, but also the patients themselves are a little bit snippy, or sometimes there's some irritation going on, or people are making mistakes they didn't usually make, things like that. And all of that just ties back into what, honestly, what we're just experiencing as a country, as a world. We're having a pandemic. You know, if any time it's understandable for stress levels to be high, it's now. And so during this time, I also happened upon this McKinsey report. They're one of those big like research studies groups. And they had warned that with the pandemic, one of the biggest concerns, one of the most important assets that are at risk right now are staff members. As they put it, almost a year into the crisis, employees are crying out for more support. And I think that sometimes that crying out's a little silent. It's more that you can see by their action. But in general, study after study after study, there's been tons of those so far, are showing that stress levels in the US are extremely high. And this is a problem, because when stress becomes too much, your employees are more likely to call in sick. They're more likely to dial it in while they're at work, not really be very productive, and even just quitting. You know, I've talked to people who say they're having a hard time keeping staff members around. So stress is something, and our team members and their mental health is something that we really need to address right now. And that means that we need to make mental health a priority. I think that all of us know, most of us here on the call are probably in some sort of managerial type of role, a supervisor or an office manager, or somehow we're working with our employees, with other team members. And it's understood that that kind of relationship that you have has a huge impact on an employee's well-being and their productivity. And so during stressful times, this relationship becomes even more important. This is sort of the time that you really let those managerial skills out, that you really focus on that and letting it shine. You've got to let your staff know that you're doing whatever you can to make sure that they're safe and that you care about them. And this may be meaning making sure that you're having your one-on-one meetings, checking in with them, maybe trying to think of like morale building activities, that kind of stuff, to keep up the morale in the team. In addition to that, though, you should also teach them to look for signs of stress. Okay, there are certain specific things that are sort of signals that our body's stressed out, and those are headaches, loss of appetite, as I joke, increase of appetite for me, poor sleep, you get muscle tension in your neck and your face, your shoulders, feeling distracted, being more emotional, whether that's irritable or more likely to cry, or all of those kinds of things are symptoms that sometimes we just write off, like, oh, I'm having a bad day, or and you don't realize that like 10 bad days all added up. And so now here you are, and it's really just high stress. So I watched this fantastic, it was a press conference actually, of some of the top healthcare providers, top doctors here in Utah, some of our big health systems, and they talked about some of the outcomes of COVID, but they also really addressed the mental health issue and making sure that we're addressing that at work as well as at home. And a couple of things that they suggested I wanted to share with you. One of them was this meditation and mindfulness. It, during stress, our body actually triggers that fight or flight reflex. I think we've heard about it. You know, you're either going to fight back or you're going to flee. Those signs of stress we talked about, like the headaches and all that, those are just part of your fight or flight reflex. That's totally normal. That's how our bodies have evolved. However, it's not healthy for us when there isn't actually a lion right in front of us. We don't have anything to fight. We can't really fight COVID or fight our isolation or, you know, whatever it is that's stressing us out. So in a way to bring yourself back to a more calm state is to simply engage in like 10 to 15 minutes of mindfulness or meditation each day. I think at work, it's totally great if you have the right staff and people who would be on board for this to designate maybe a certain time during the day, or certain breaks where you encourage people to go and have like 10 minutes of meditation. Or I know that we have some apps that are available to us through our health provider plan that has some meditation tools on them. Or maybe you want to create like a little space in your office. It's kind of like your Zen area where people can just decompress a little bit and reduce some of that stress. In addition, and this is something I thought was super fascinating, these same doctors talked a little bit about how, again, our brains have evolved that when we're in a high stress situation, our brains automatically start scanning the world all around us, looking for like potential problems that we can fight, potentially negative things. And I think that, I mean, I'm sure I'm not alone. I hope I'm not alone, but 2020 has been chock full of negative things that our body can find. You know, there have been all kinds of challenges this year. Unfortunately, as we start focusing on all those negative things, we actually increase our stress levels and feel more depressed and more discouraged. What the doctors explained, however, is these stress circuits in our brain that are kind of lit up out there, like searching for bad things, can actually kind of be rewired simply by, this is what they explained, if you write down 3 things every day that were good, 3 good things. The writing is one key part, not just thinking about them, but actually physically writing them down. That kind of connects the sort of physical with the mental. If you do that for 2 weeks straight, studies have shown that it kicks you out of that sort of high stress circuit thing for 6 months. I thought that was so cool. And in fact, I was telling some of my older kids about it, and my oldest son said, "Oh, I've started doing that and I love it." So I think that not only is it something that would be great for, you know, just to share with your employees, but if your staff members are the type who you feel like comfortable with, you could have them share it. Like everybody, hey, why don't we all write down 3 of the great things that happened today at work? And as you do that, it's gonna kind of lower some of those stress levels and help them be able to work harder and be more productive. And of course, be a good role model. Just like we talk about the oxygen with when you're flying in an airplane, you always have to put on your own oxygen mask first before you help others. So we got to do the same thing with stress. You've got to work on reducing your own stress as much as possible so that you can be there in order to help others. Part of the staff's mental health, however, is also just going to be about providing the safest possible environment. Studies have shown, I think it was the same study that I mentioned earlier, found that the top stress right now in the pandemic is actually fear of contracting the virus, or even worse for most people, bringing it home and giving it to susceptible friends and family. That's one of the very top stressors right now. And this isn't just in healthcare, this is across all industries that this is a huge stressor. So in healthcare, obviously those fears are even greater because there is more of a risk of contracting it. So it's not uncommon at this point that it's been a long time. We've been nearly a year into this. And so it's easy to see how maybe we might let our guard down a little bit when it comes to safety. but it's just important to stay vigilant, especially since we're experiencing this surge. If you show your employees that you really care about their safety, that's going to reduce some of the stress they're feeling. They're going to feel more loyal to you, and they're going to want to work harder and be more dedicated. So continue to keep that safe environment. Again, some of these things that we've been doing, symptom checks, be strict about having symptom checks for your patients and your staff as well. You could use the park and text for your waiting room. A lot of people have been doing where patients come and instead of having them in the waiting room, they have them wait outside and text when they're ready, and then they can bring them in. You can also use plexiglass. That will at least protect your staff members more. However, makes it a little bit more complicated. You got to make sure you're keeping people 6 feet away if they're sharing the waiting room. Things like contactless intake forms, contactless payment, that kind of stuff. Those should be things that you can remove potential for spreading the virus, removing non-essential items from the practice. So that's inside the actual exam rooms, out in the main areas, glasses, if you're selling glasses, you got to make sure that everything can be sanitized and cleaned. And over time, sometimes things that we maybe cleaned up or put away, they can start to build back up. Like I go to see an ophthalmologist, and they have been excellent in their safety protocols. They make me feel so safe every time I go there. And one thing that they had done was actually change out all their furniture. So they left their waiting room open, but they have a very large waiting room. And they just simply separated all of the seating so that everybody had to be, I think it's more than 6 feet apart in their office. However, I noticed the last time I was in there that some of the chairs had gotten a little bit scooted together and probably were outside of the range. I was telling Jacqueline, I think that I'm probably like the scariest patient for healthcare practices to have, since all I do is research what are the best practices. I'm always paying attention. I don't say anything though, but I do notice when things are a little bit off. And that's one that I noticed, that they'd been doing an incredible job. However, their seating had been moved, so they were back too close again. So just kind of keep an eye on that every day. Make sure you're going out, checking it, and seeing that you're keeping things safe. Sanitization, continue with that. Don't give it up as time's gone by and we're getting tired of it. And make sure that you can use telehealth wherever possible. I know it's hard in some industries, some specialties, but there are consultations and visits where you can take advantage of it. So do that where you can. I think really though, just showing that you're really making an effort is what's key in employees and staff members feeling that they're safe and feeling that you actually care. In addition, we should also make sure that we're being flexible. As we talked about exposure, and I'm sure since the majority of you have had some exposure already, you know that every day might look a little bit different than what's normal. So right now is not the time to be inflexible. It's the time to practice our flexibility. And we may have to move people around from place to place, or maybe if somebody is being quarantined or they are sick, if they can work from home, there are ways that you can give them tools or technology or things that there are things they can accomplish from home. Try to start thinking about those kind of things so that everything doesn't fall apart while they're gone. And also I wanted to say, this is a hard one, but don't pressure employees to come in if they say they're not feeling well. And the reason I say this is because I've talked to a couple of people lately who have been starting to feel really frustrated with certain employees. And I don't know if you guys have experienced that yet. If not, I'm glad for you. But employees who maybe are calling in sick a lot more. And I think that it's a couple of things. It's A, maybe they're being super cautious and they get the tiniest little something and they don't want to spread it. Or, B, maybe they are a little bit more nervous and feel like they, are sicker than they are, maybe even a little bit of a hypochondriac or something. Or there are some who are maybe taking advantage a little bit of this time. I think that's the minority, however. But here's the deal. So I've had people I was saying that I talked to who said, I just really haven't, I'm frustrated with this employee. They called in sick 2 weeks ago. They called in sick 3 weeks ago. They called in sick 2 months ago. They're constantly calling in sick, and I don't know what to do about them. So one of the best things to do is to make sure you don't pressure them, because if it does turn out that they ended up having COVID, that is bad news for you. So absolutely make sure that if you're going to make a mistake for now during COVID, err on the side of being too lenient with these employees rather than too strict, because otherwise it's going to come back to bite you, especially if they are a valued employee. If you need to sit down and talk with them a little bit about what's going on, again, some of that one-on-one communication, and maybe they are really stressed out, or there are things that you can do to help relieve some of that stress, then that's fine too. And then remove some of their workload during times of stress. And everybody here has probably experienced this themselves, but during times of stress, studies show that our ability to actually handle tasks diminishes. They do all those little tests where you see how many you can accomplish in an hour, all of that goes way down when we're feeling stressed out. So if you can remove some of their workload, some of the menial tasks, have them save that mental stamina for things that really matter. There are lots of things in a healthcare office that can be taken off their plate. And in the following section, we're going to dive into kind of some of those things. But anything you can do to kind of cut back on busy work will help make sure that they have their best part of them saved for the most important things, patients in front of them. And so let's talk a little bit about that, turning technology into another team member, or 2 or 3, I like to say. There are a lot of ways to use technology to take over a lot of those kind of busy work tasks. I had somebody who said to me once, "Oh, I love technology. It really is like my favorite team member." And that was where I kind of was thinking with this idea. Technology, it works 24/7. It never gets sick. It doesn't need a quarantine. It never complains. But really, what technology can do is cover those gaps for when employees call in sick. It enables team members to do work remotely, and it really just kind of takes off some of the more menial tasks so the people in the practice can focus on more important, revenue growth type activities, or patient satisfaction, building relationships, those kind of things. So I hear a lot of people say, "Lori, I like the idea of technology. However, is technology just gonna take away my job? Like, what if I use technology to make all my appointment reminders or whatever it is, then what am I supposed to do?" And this is where I want to say, do not worry about that. Technology, there are always higher level activities. There's so many things that could be happening in a practice that aren't happening because we're sucked into a lot of time stuff. And this is especially true during COVID, when our ability to manage tasks is lower. So I was having fun thinking about some of the old kind of technological kind of jobs that people used to have that have been taken over by technology. And I kind of went down that rabbit hole the other day, and so I wanted to share a few of them. A bowling setter. There used to be a job where the person would put up all the bowling pins every time somebody went bowling and they got knocked over. Obviously, technology took over that role. That person found something else, something better to do to help the bowling alley. Of course, we used to have telephone operators who would connect house to house, and I think I'm not sure it's my mom or my grandma who would share about what that was like when they could still be on the line, or they're moving it from place to place. We don't need this anymore. However, there were better ways that these people could use their time. Elevators. So I used to think that the elevator operator person was just for rich people who you'd go in you were so rich that you couldn't even push the button or something. And I actually found out that running the elevator was a little bit more complex back then, and the technology wasn't up to speed where the elevator would actually stop necessarily on the right floor. So what they did was they needed an elevator operator who was experienced in being able to make sure the elevator got to the right place, and that was what they did. So that used to be an old job that we no longer have. Alarm clocks. This is one I hadn't even really thought about, but there used to be somebody you could pay somebody, and you had to get up early to come and tap on your window and wake you up so that you could be up in time. This happened all the way till the 1920s, which I thought was interesting. And so we obviously don't need that job anymore. My favorite one that I was thinking about is because my grandma worked in these typist pools. They used to, the other day, just my kids asked me, they said, "Hey, Mom, I was trying to think, like, how did people work before there were computers? Like, how did you go to work? What did you do there without a computer?" And so I kind of shared a little bit about some of these typist jobs where people would go in and, maybe whoever was working on some project, they would give off notes to their secretary. The secretary would take that here to the typing pool where people would simply type it all up, and then it would go off to people's inboxes and their outboxes throughout their company. Obviously, this is a position we don't need anymore. We don't have this role anymore. But the thing is, just because we use technology to replace some of these tasks, it doesn't mean that now suddenly everybody was out of a job. What it meant was that we can now spend time on more important tasks and things that are actually going to accelerate your business even more. And that's the same for healthcare. There are a few different ways that I see that you can use technology to kind of remove some of those tasks that aren't necessarily always needed right now. Automated recall, online scheduling, appointment reminders, digital intake, digital payment, two-way texting, product notification reminders. In fact, I was thinking the other day, let's say that almost everybody at your practice was sick. What steps could you do, whether you're remote or through technology? How few people could you actually have at the office? Because I was thinking, you could have somebody hopped online, they scheduled their own appointment, an automated reminder was sent out to them. When they came, maybe you two-way texted with them to talk to them about what they needed, and sent them digital intake form, requested their payment digitally, and if after the visit they could even get a notification, "Oh, hey, your contacts are in," or whatever it is that you may have. There's a lot of roles there that obviously are a lot of them. We want that human touch. I'm not saying let's all move to having just the doctor there or something, but there are a lot of ways that technology can help remove some of these and can take place even virtually during the pandemic. So I'm curious on which tools you are currently using and which ones just are more popular for you in your specialties. So Jacqueline, do you want to get that poll for us? Awesome, thank you. Great, we're going to wait about 3 more seconds. All right, perfect. Jacqueline, you want to close that? Perfect, thank you. So it looks like most of you are doing automated recall. That's awesome. We've got the majority of you are using digital intake. That's incredible. I have to say, online intake forms changed my life. If you've ever been in any of my other webinars, you'd know that I have 7 children and I love them, but boy, all 7 have glasses first, and of course they always had to go to the dentist, the doctor, everything else. And as a mom, my kids were really close together. It was a nightmare. It's always been a nightmare taking them in and needing to fill out all that paperwork. Literally, if I scheduled a bunch of them together so I could save time, I'm handed like piles of clipboards and I'm trying to fill them all out really fast while I'm also trying to watch my kids and make sure they're not fighting and getting into things. And there's one who's crying and scared over there and one that's climbing up my head. I don't know. It's always been a nightmare. And the first time I had online intake forms, I thought I'd like died and gone to heaven. So thank you for all of you who do that. Online scheduling, oh, I hope more of you get it. We don't have the majority of you having online scheduling. That's another one, especially if you're like an optometrist. My kids, I kid you not, are always like, oh, mom, I really need to get my eyes checked, or I need new glasses. Again, like I said, all of my kids have glasses. And they always tell me at like 7 o'clock at night. And then I say, shoot, the office is closed. Call me tomorrow, remind me tomorrow, and I'm going to schedule then. This literally can go on for like months until I forget, because after school, I don't know, after work, after school, that's when I think about it. So having online scheduling means that I can be like, fine, I'm going to just jump online, schedule the appointment, and I'll be done. So my optometrist does not have online scheduling. So literally, my daughter asked me like 387 times recently. She's home for college for the Christmas break. It's like, I really need to be in to be seen. And yeah, I kept forgetting. Digital payment, that's our lowest use, it looks like. This is one that's really taking off. I talked to an office just recently who said, I wish everybody knew more about using digital payment. It has changed like everything for us. That's one of those things that they talked about. Boy, she talked about how when their office was closed, their doctor actually got COVID, but he wasn't sick, he just was bored. She's like, I wanted to say, just send off payment reminders through text message, that kind of digital payment stuff, product notification reminders. All of these are really great. It's good to see though that so many of you are using automated recall. That there's so many ways to optimize it as well. Recall is one of those things that when I say, oh, technology can take stuff off your plate, one of the things that I recommend you do with that extra time is actually like optimizing your recall. I need to do a whole webinar on that. You guys, in the end, there'll be a little survey. If you want to hear about like ways to optimize your recall, put that in there, because I have so many ways that you can make your recall like way more effective. So that's something that I always think that's kind of that next level up. So when you do have more time, work on optimizing your recall. Okay, back to it. Thank you guys for sharing that with me. That's super interesting for me. Finally, I want to make sure that you've developed a strategy to keep your practice running no matter what happens. We don't know for sure exactly what's going to happen over the rest of the winter. I say the rest of the winter. Winter hasn't even technically started yet. But, over the next few months, we have to have a strategy that, let's say that things got really bad. Let's say there were new lockdowns, especially in certain states. Here in Utah, we've stayed open fairly well. However, I know some states have had a lot stricter requirements. And so if you do have to shut down, or if you can only, be seen for emergencies or whatever it is, keep a strategy right now, develop one on what you could do to keep things running. And also if, you have employees who are out, things like that. I say start with automation. Again, hire those additional team members in terms of technology to manage the tasks when you can't. Examine where you're at. We just took a poll here, kind of talking about things that people have, and determine what you could do, where you could perhaps take better advantage of technology to help you keep running if things were crazy. I recommend you always cross-train your employees. So every job should have at least 2 people who can manage it. Nobody should ever be irreplaceable, even though you're irreplaceable. You really shouldn't be. So I start today. I know, again, this is kind of a crazy time. We're already a little bit stretched thin, but if you start today, you're able to get people out there learning different systems. Maybe you need to have somebody in the back or somebody in the front, or whatever it is that you're going to do. Start getting everybody trained so that if people do need to be gone, especially for an extended period of time without a lot of notice, that you're able to keep functioning. And I say just start today. Even if you haven't done it, start today. Consider part-time staff members. So I've talked to a few different practices who have kind of been playing with this idea. Some of them have actually hired a part-time staff member to kind of help cover absences. This might be a great time to kind of look at that. You may even be able to get somebody who is specifically just supposed to be flexible or designated to cover times when you need somebody. I have other practices who actually use the part-time staff member strategy on the long term. So they may have 2 part-time members instead of 1 full-time, and that gives you a lot of flexibility as well, so that if you know, one of them needs to be gone, then hopefully you would have set some sort of expectations early on what that would mean for them. And so make sure that you have, that's one option that you can go for. And then create work at home tasks. So kind of like we talked about before, picture a situation where you're limited to very few employees on site. Like imagine how few you can go down to, and think how you would keep things going with a skeleton crew. Okay. Those, again, appointments online, automated reminder sent, quarantine employee maybe can send out digital intake forms, payment requests, all of that kind of stuff. Which parts can you be managed remotely or digitally? I would create an entire list of like, here's my things that somebody needs to be doing if they're quarantined at home, and keep them busy. And then, you know, that could be requesting overdue balances, texting back and forth with patients, data entry, insurance stuff, whatever it is, especially if you've cross-trained people, then those tasks can be managed when those people are at home. So in lots of cases, there are ways to keep things going, even just with 1 or 2 people in the office. So create that now. That's going to pay off dividends later. And finally, I just want to say, I shared this horrible picture of me just to say, hang in there. This was me a couple months ago after a particularly bad workout. And I think it's how we all feel some days. I'm just so impressed with everything you guys do. You have so much to manage. I have been in the middle of a big project where I am really trying to kind of step into your shoes and understand more of everything that goes on every day for you. And I am insanely impressed. So I just know, you know, I had somebody say to me the other day, I can't imagine, you know, COVID has thrown me for such a loop. I can't even imagine being like a new office manager or a new doctor or somebody who's new to this, trying to throw that monkey wrench into the mix. And so I'm so impressed with what you do. Hang in there. I do want to say there is great light in the horizon. I think by the fall, hopefully, we'll be back to more sort of normal. We always say the new normal, but it'll be a little bit back, hopefully. We'll have been getting some people vaccinated, and we shouldn't have to worry about all the things we are now. So whether you've had closures or revenue hits or whatever it is, just make sure you hang in there. We did want to open up for a few questions if we had any questions. Jacqueline, are you there?
All right, we do have a couple of questions.
Okay, great.
So what if you get resistance from team members being cross-trained in the practice?
Oh, that's a great question. So I would approach it in a method of seeing what they are interested in. So, you know, maybe you've got somebody who would love to do some marketing or social media, and maybe you've got another person who, you know, it's all about kind of having those one-on-one meetings and finding out what their career goals are and where they want to move from, and then pair them up with the people in the practice who are doing those same sort of roles. Now, if you have somebody who's very protective of their role, because that's kind of the flip side, somebody who doesn't want to train someone else because they don't want to become irreplaceable, you just will have to have a conversation about it's really important that this has to happen. Of course, being understanding, but helping them understand that it's important for everybody to, for there to be multiple people. Does that help?
Yeah, I think that's a great answer. If it is available to us, do you think we should be able to offer rapid testing from our practice to keep team members safe and patients?
Yeah, this is a great question. I think one of the keys, for all healthcare organizations is to be creative and to be innovative. And if, you're going to have to check your own regulations within your own state and your accessibility, but for sure, offer additional services that are a little outside of your norm. That's where you can make additional money and kind of stand out. We had a couple of questions actually in conjunction as well. I don't know if you guys have heard this, but a lot of states are pushing for like dentists and optometrists to be approved to administer vaccines. So that may be another place. I know Oregon, I think, is one of the only states that's approved that so far. We're early into the vaccine stuff. So at some point, that may be something that can be offered. We also had somebody ask earlier if it would be required for all staff members to get vaccinated. And so that's an interesting question. My understanding is from the things I've read, it is legal for you to require as an employer can require that their staff members get vaccinated. Of course, there can be exceptions and you need to be understanding. In healthcare, of course, I know that I saw the American Medical Association had put out a thing saying, it's kind of ethically important for physicians and those working in healthcare to be vaccinated and to try to encourage their staff members to be vaccinated as well. So there's a lot of those kind of questions. But for sure, be open and be creative to doing those kind of things.
Well, I think that sounds wonderful, Lori. I think that you have answered a lot of my questions today, and I hope that everyone feels like they've learned something that they maybe didn't know before about preparing their office and making sure everyone stays safe in this pandemic that we seem to keep having surges in, right?
Yeah, for sure.
I know. Well, I think we're getting to the end of our webinar. I did want to let everyone know that we are offering this special offer. If you are looking for some of these tools that Lori spoke about today that can help you with your behind the scenes busy workloads so that you can be more available when patients are standing in front of you, we are offering a $50 Amazon gift card for your time to take a quick demo with a product specialist from our team. And I don't know if Lori has a special offer on top of that.
You know what? So as soon as this ends, everybody, you're going to get like this tiny little survey. It's 5 questions or something like that, asking about, what you thought of the webinar, and if you have other topics you'd love to hear, again, like if you're wanting to hear about recall or whatever, share that in there. But one of the questions is, would you like to hear more from a solution reach from us somehow, if you want to learn more? So we have 2 awesome things going on, and this is amazing for you guys because we don't have a huge number here on this webinar. So number 1, if you fill out the poll, you get entered into a drawing for some AirPods, which is amazing. I don't have any and I really want some. I wish I could be an attendee at my own webinar, but so just by filling that out, you get entered into a drawing. In addition, if you go ahead and say that you're interested in speaking to someone from Solution Reach, not only will you get the $50 gift card, but you can get entered in again. So that would be a second drawing. So we're giving away 2 pairs of AirPods, one for anybody who does the survey at all, and one just for all of those who are interested in hearing more from us. So you have a really great shot here today. So I'm very excited about that. Be sure to fill that out. Honestly, just everybody have an awesome, awesome, awesome holiday. And please feel free to reach out anytime if you have questions about anything. Honestly, I spend so much of my time researching everything in the industry that if you have questions, feel free to reach out and we would be happy to answer. Anything else from you, Jacqueline?
I think that sounds wonderful. This concludes our webinar for today. Everyone stay safe and healthy and have a happy holiday season.
Yep. See you, everybody.
Bye.